And I suppose before I speak, I'd like to offer my condolences and sympathies to the family of Dr. Ali, who died so tragically, having looked after so many others. I want to also commend all of the healthcare workers, the healthcare professionals and everybody who supports them to do their work. And I want to congratulate you, Minister, on having been appointed Minister for Health. I'm sure you'll do a fantastic job, and it must be a huge honour for you to lead such an important department. I was brought up in a GP's practice. My dad was a GP, and the practice was in our home. And for more than 40 years, it was a community-based medical card practice, looking after patients from Cabra and Phibsborough, the Navan Road, the North Inner City, Dublin 7. So I really do understand the unique relationship that patients have with their GP. It's incredible. He's retired almost 10 years, and still every day people talk to me about Dad and Mum and the whole thing. So it's a really valuable thing that you're doing here today, giving people access to their GP, allowing every child under 12 have the opportunity to have, regardless of who their parents are, to have access to GP care. I lived in the States, I lived and worked in the States. I was shocked by the commercialisation of it. I remember one day a person collapsing on the street in front of me, 2 ambulances pulled up. The first thing they did was go through the person's wallet and check for their insurance card. We as a government, I'm really proud, have committed to the implementation of Sláinte Care, which will bring about universal access to health care for people based on their medical need, not on their ability to pay. And this piece of legislation, I commend you for bringing it so swiftly through this House and the other House. I would urge all members here to support and pass this legislation. It is a step change, and it is a really strong signal for how this government intends to deliver healthcare and make it available to the people of our country. You mentioned the GPs. As I say, I grew up in the practice. I know the enormous effort and commitment that is given by the individual GP, but their families and all their support staff. GPs are under pressure. Far too many of our GP practices are struggling financially. We don't have enough GPs, and I think it's really important that you and the government have recognised this, that you're taking a phased approach to this, and that we address that issue in a managed way. We still have COVID-19 to contend with. It is great that the screening services are recommencing, but expanding the healthcare service and expanding access to the healthcare service is an important principle that we don't abandon, that you're not abandoning, the government isn't. And it wasn't just an election slogan, it wasn't just something to put in the manifesto. It's real legislation that will be backed up by real action by you and the government, and I commend you for that, Minister. Gormagat.